for the August recess.
Let's ask Republican Congressman Paul Broun of Georgia and Democrat John Yarmuth of Kentucky. Welcome to you both. Representative Broun, I'll start with you as a doctor, an MD. Really interested to hear what you like about this plan. There's so much discussion about what Republicans dislike about it. Is there anything in there that you like?
Well, health care is too expensive for everybody, and families are in crisis about the cost of health care. But we can lower the cost of medicines, doctor's visits, insurance, and all those things if we do it right and take our time. The gentleman, the small businessman you just had on prior to us, is exactly right. There are going to be millions and millions of jobs that are going to be lost because of this Obamacare plan that's being promoted here in Congress, and we need to slow down. Many Republicans have offered alternatives that would not increase the debt and deficit and would keep good quality health care. And this bill that is before us now is going to destroy the quality of health care. It's going to put a Washington bureaucrat between their doctor and the patient. The Washington bureaucrat's going to be making health care decisions. People are going to be denied the x-rays, the surgeries, the life-saving drugs that they so desperately need because of this bill.
Congressman Yarmuth, I know we could get into a debate about whether this bill is right or not, but I'd like to ask you, because you're a Democrat, about the Blue Dogs. In particular, folks like Mike Ross, a Democrat from Arkansas, former small business owner, like yourself, I should add, who is very much against the bill as it has now been spelled out because he says it'll just cost too much. How much difficulty is the president going to have in reining in the Blue Dogs?
Well, I mean, he's talking with the Blue Dogs on an hourly basis, and I think they're making some progress. Everybody wants to keep the cost of any reform proposal down as low as possible and wants to find whatever savings within the existing system that we can. We set out to do that, and it's going to be a long journey. Whatever we do this year, and I think we will do reform this year, is not going to be the final step. But we have to
let me just stop you. You keep saying this year. You're not saying before the end of August. So is that deadline gone?
Well, I think we've had a sort of a deadline of August to get a bill through the House. Now, we don't know what the Senate's going to do, but it's pretty obvious that we're not going to have legislation on the president's desk before the August deadline, and I think he's expressed that. It needs to be this year. I just want to mention, by the way, Paul talked about the doctors. The AMA are supporting this, this legislation.
Which is Representative Broun, what I was just about to bring up, and that is that the AMA has gotten on board, but I'm sure there are things that doctors are concerned about as well. But I want to go back to my original question, which was, what is in there that you do like? Because you came out calling it Obamacare and slamming everything about it. Is there anything in there that could at least be a basis for a compromise that you like about this plan?
Well, we can work together in a bipartisan way to find a bill that is good for America, good for small business, good for the individuals, and can do the things that we want to do. But that's not what's happening here. It's being done in a very partisan way. Nancy Pelosi and Barack Obama are trying to force this down the throats of the American people. They are not consulting the doctors on our side, I know, and they're not consulting Republicans at all. They're just doing the bill that they want to do. And in fact, this is the wrong direction because the CBO just last week said it wasn't even going to rein in the cost of care. Care is going to go up and be more expensive. They also, CBO said last week that even after 10 years, there are going to be millions of people that don't have insurance, even under the Obamacare plan. So this is not the right plan. We need to go back to the drawing board. We need to work in a bipartisan way to find common sense, market-based solutions that will work to lower the cost of health care, insurance, medicines, doctor visits for everybody. We can do that. Republicans want to do that. Unfortunately, the leadership on the Democratic side don't want to do that.
Well,
they want to slam down the Obamacare down the throats of people.
Congressman Yarmuth, I got to ask you, what do you think the president can say, or what do Democrats who have proposed the bill outstanding, how are they going to change it in order to bring not only Blue Dogs, but maybe even some Republicans on board?
Well, I think the first thing the president has to do tonight is to talk directly to the American people, to small businesses and individuals, to say, here are the benefits for you. we haven't gotten that message out well enough. And there are substantial benefits for small business and for individuals. We talk about cost. And one projection is that family coverage is going to increase by $1,800 a year, which means by the end of the next decade, we're talking about $30,000 insurance policies. And the insurance, the small businessman you had on before, he can't afford that no matter what percentage he pays, and neither can the economy. So it's critical that we act now, and I think the president will make that case. But again, every American has to know what's at stake for them personally, because that's critically how they're going to make their ultimate analysis.
Yeah, and Dr. Brown,
I'd like to add this, too.
Dr. Brown, as we finish up here, we don't hear a lot in this plan on either side here about tort reform and clamping down on medical malpractice lawsuits, getting, the lawyers to take a step back from all of this, which we know adds huge cost to what's going on. Would you push for that?
Well, the Democrats have totally ignored that issue, and it is a huge issue. But I want to go back to something that is extremely important that the American people need to understand. They've been promised if they like their health insurance policy that they have today, they can keep it. That is totally false. They're not going to keep it. Every single small business, every government provided plan is going to be mandated by the federal bureaucracy, by the health care czar or commissioner, and it's going to drive down wages. People who are working today and are being provided health insurance by their employers are going to take home less money if this is put into place. And plus, it's going to put millions of people out of work. So it's going to be disastrous for America.
Run out of time. Congressman Yarmuth, I promise you, the next time we have you on, we're going to start and finish with you. Thank you, gentlemen, for coming in.
Both of you will come back. Thank you so much.
And you can watch our special coverage of President Obama's news conference tonight with Neil Cavuto, 8 p.m. Eastern, right here on Fox Business.